Yesterday, President Shavkat Mirziyoyev chaired a meeting focused on improving primary and specialized medical care, regulating drug use, and raising the quality of medical education. More details about this are in the following report.
Over past 7 years, healthcare funding in Uzbekistan has increased sixfold. Many medical institutions across the regions have been modernized. Now, more than 400 advanced surgeries, previously only done in the capital, are also performed in regional and district hospitals. A system now connects primary healthcare with specialized medical services. Currently, there are 29 doctors for every 10,000 people in Uzbekistan, a figure comparable to the United States, United Kingdom and Finland, and higher than in Turkey and Canada. However, the effectiveness and quality of treatment still need improvement. For example, due to poor primary care in some districts, illness and complication rates remain high. Non-communicable diseases cost the country about $1 billion a year. Every fourth ambulance call is for chronic disease patients, and in some areas, ambulances are used like outpatient clinics. There are also uneven distributions of staff, hospital beds, and funding between district and regional hospitals. The introduction of health insurance has been delayed for years. Waiting lists and medical services still lack full digitalization. Due to these issues, two deputy health ministries were dismissed, and one was given a warning. The meeting focused on improving primary care, disease prevention training of medical staff, and better treatment quality. A new system will be introduced based on population needs and disease analysis. Primary care will be reformed. Each medical team will sign a contract with the population it serves, and citizens will be free to choose their family doctor, including private ones. A guaranteed healthcare package, including fully funded services and medications, will be approved. Family doctors and nurses will now work full-time. The number of obstetricians gynecologists in clinics will be doubled, and there will be one pediatrician for every 3,000 children. Doctors' offices and family clinics in districts will be reorganized for better coverage. Central polyclinics will become consulting and diagnostic departments of district hospitals, concentrating all specialized doctors. Family doctors will earn a base salary of $500 per month, and nurses will receive $300. Additional payments will be given to those with qualifications. For active working communities, such as managing chronic diseases and detecting serious illnesses early, family doctors may earn up to $1,500 and nurses from $600 to $800. This new system will be tested in 15 districts and cities this year and across Samarkand region next year. At the same time, family doctors and nurses will have increased responsibility. Heart attacks, strokes, early deaths of mothers and children, and disability from chronic illnesses will be treated as emergencies. Corruption and disability assessments will be stopped. Now decisions will be made based on reports from family doctors or medical social expert commissions. Officials and regional leaders have been tasked with implementing a 90 Days of Changes in Medicine program to improve order and hygiene in clinics. A Clean Hands initiative will be introduced in schools and social institutions to improve sanitary conditions. Specialized medical care was also discussed. Only high-tech surgeries will be funded by the state in national medical centers. The system of electronic referrals will be overhauled. A national electronic platform will list available treatments and prices, allowing patients to choose any clinic, public or private ones referred. Pediatric oncology will receive special attention. Currently, 75% of child cancer cases are detected too late. A 5-year $110 million program will be launched to fight childhood cancer. The issue of drug use was discussed separately. In developed countries, only drugs with proven effectiveness are used. However, in Uzbekistan, 42% of imported drugs lack proven effectiveness but are still prescribed. The health minister has been instructed to remove such drugs from clinical guidelines. All hospitals, especially children's hospitals, will be checked for proper use of antibiotics. Medical education is another key issue. While admission to medical universities has increased to 25,000 students per year and 40% study in private institutions, there is still no clear system for testing students' knowledge and skills. Now, a National Center for Medical Assessment will be created to evaluate both students and practicing professionals on their ability to use modern methods. All clinics, public and private, will need accreditation. The professional development of medical workers will be handled by universities and regional centers. Dual training will be introduced. Medical universities will be placed under the control of clinics and given financial independence. Finally, all responsible parties have been ordered to use budget funds wisely, speed up digitalization, introduce insurance, maintain discipline, and improve public satisfaction with healthcare services.